Welcome everybody to this session on vector-borne disease. The topic came a lot in conversation this morning and this afternoon already, so we're very happy to build on this. We brought together a really great cross-disciplinary panel. So I'm Jonathan Suk, I'm from European Center for Disease Control. I have Flavia Riccardo from the Italian National Institute of Public Health, Joacim Rocklöv from University of Heidelberg, Richard Allan from the Mentor Initiative, and Spiros Mourelatos from Ecodevelopment. So thank you all for joining and thank you all for making the trip. We're going to start with a set of 3-minute presentations and then we'll have a bit of a panel discussion and some questions from the audience. We have a bit stringent time, so we have I think until about 5 o'clock, a little bit under an hour. So we'll go right to it, and Joacim, you're up first.
It's on. Thank you. Thank you for the invitation to be here. It's a pleasure. When it comes to vector-borne diseases and climate, it's probably one of the most researched topics in climate health. Although it's a lot of discussions until very recently, I would say. If you look at the ectoterm insect, which is insects transmitting vector-borne diseases, it's pretty clear that they depend on climate. And with different weather conditions, they vary in population. They live different lifetimes. They have different behavior, and they transmit diseases differently. So, for example, their incubation period, they have an incubation period, an extrinsic incubation period. It has different lengths in different temperatures. Temperatures, humidity, rainfall, pretty well known to affect vector-borne diseases generally, both tick-borne diseases and mosquito-borne diseases, which would be the big ones. In Europe, we see quite dramatic changes over the last years, I would say. 15 years ago, people were talking about it as a distant thing. Right now, I would say it's quite much happening. You could see quite big changes almost every year in the expansion and distribution of Aedes mosquito, like the tiger mosquito, for example. You could see this year in Greece that they didn't actually overwinter, which is a quite dramatic change in their behavior. And for other vectors and ticks, you could also see changes. So it's really now, it's not in the future, it's happening. And the projection studies we did 10 years back or so are, in a sense, realizing. I think if we would go back and look at what was actually predicted and what actually happened, you'd see quite some correlation. Okay, so that's really important. So we have to do something about it. Thinking about what we can do, we can understand the situation better and we can prepare to the situation. So by doing that, we could and we should feed into different policies. So prevention, I think, is super important. It's been up in the discussion before. Like if we have a planet with bad health, we're also going to suffer bad health as a community, as humans. So that's the prevention opportunity to actually address the ill health of the planet. And we need to do that. And we can do that by doing projection studies, for example, that inform climate mitigation, that inform what's actually going to happen. And those could be on the long term only mitigation, so only, and to some extent maybe the expansion of nature-based solution and these type of adaptation mitigation options that sort of have synergies. At the shorter term, we could do, we need to adapt and we need to prepare to the residual impacts, the ones that we can't prevent, basically. Although prevention would be much more effective because there is limits to adaptation. And we're not going to be able to adapt to everything. That goes as well for heat or floods or vector-borne diseases. There's limits to adaptation. We can try to do as much as possible to build the resilience, and that could include early warning systems and better responses, better strategic management, better surveillance systems and detection systems in areas where there is emergence of vectors and where pathogens are introduced. But that's not going to fix the whole problem. That's just going to be trying to keep us resilient to the new situation. I think I'll start there.
That's a great starter, and I think it's pretty alarming, and it's also very true. I mean, looking back to some of the old work we've done at ECDC that's been done at WHO, and those projections, at least for the EU and EEA, have come true, and not much has changed on that side. But we're much more aware now of also some of the cross-cutting issues. Jan Semenza was talking about the intersections with vulnerable groups, with cascading risks and so on. And now there are also many different adaptation initiatives, and it was also mentioned that there's risks from maladaptation in some way as well. Richard, can you take the floor and expand on the topic and build on what Joacim was saying?
Sure. Well, thank you very much for inviting me to be here today. I'll take a different angle. I've worked for 36 years in wars and natural disasters in pretty grim countries. And asking good scientific questions comes from understanding what settings you have to ask them about if you want to make a difference. Today we have 110 million people displaced. It's a much bigger forced displacement population across the world than we ever saw after the Second World War. And the very big difference is that all but those in Ukraine live in countries which have high burdens of vector-borne disease. When you have 110 million people that are displaced and outside of their homes, their likelihood of being bitten and suffering worse disease is far greater. But also that brings with it another set of interlinked problems, which is malnutrition. Malnutrition comes with it, and you see very high rates in many of the disasters where you have the maximal population movement, which overlays also with the maximal vector-borne disease density. We see it very clearly in malaria. We've had a 41% increase in annual malaria deaths since 2015, if you go back and look at WHO's data. It's quite shocking. I was the guy at the beginning of the WHO scenario getting it started, and huge successes, but we're now going backwards. And actually, we've never really got on top of it in those countries, perhaps because we haven't quite got our heads around the question. But when you take these two converging areas of mass displacement, malnutrition, and increased density of disease and transmission of disease, that mass population always ends up in third countries, moving at some rate, at some point. 60% of displacement ends up in urban settings. And in urban settings across Africa, as one example where you've got the highest density perhaps of the killer VBDs, you have 60% of the population moving into slum areas of urban cities. And the water and sanitation situation for those cities simply cannot keep up. So we have 2.2 billion people without safe drinking water today. But that's an example of how far behind we are in linking together issues, because in the same setting where you have that lag of supplying essentials like water, you have a dependency for water containers. And that means insects that promote, transmit all the flaviviruses, but also West Nile, and now also malaria with a new vector, not new, new to Africa, Anopheles stevensii, are finding homes at a rate that's alarming in urban settings in Africa. And the rate of expansion of disease in those urban settings is very, very quick. Those populations are immunologically largely naive. And when they get sick, we're likely to see very much more disease at higher levels, worse levels of disease. That doesn't stay in a continent. And 10 years ago, I presented on diseases over there, as we always used to think about tropical disease, rather than here. But now it's here, because it has moved. We've got massive global population movement. We have migration, we have holiday making, we have just an enormous movement of people. Vectors in Europe used to be naive. They were infected by humans. They were insect populations that we've been very good at beginning to get a hold of, but they didn't carry disease. Now we have disease, now pretty well established, in a way that we can't, to echo the words of the gentleman on the front row, think about research as being something that we start as if it hasn't happened or is only just happening. We've had vector-borne diseases right the way through with Western Nile and also leishmaniasis, we forget that. As a consequence, not just of the overall climate change giving an inducive environment for vectors, but because we are moving disease, and we're moving it because we're not tackling it where it's coming from. We've had a 60% reduction in funding in most of the vector-borne disease highest burden countries that are troubled by war in this last year. So we're moving money around, not because it's less, but because there are many, many priorities. And it's having to go to Palestine, it's having to go to Ukraine, all very, very reasonable priorities. But in so doing, we're pulling it away from the center of where disease is. So it's a balance. It's very, very interlinked.
I think your comments also touch upon many of the themes today. I mean, at the highest level, you're talking about funding priorities and challenges, and of course, this speaks to our ability to communicate the research in policy settings and to decision makers, and also to orientate it towards action. You talked about settings, and again, yet another example of the need for qualitative research to better understand the settings where transmission is taking place and the vulnerable populations that exist there and the reasons for that and so on. Flavia, working in Italy in a public health institute, you don't just deal with one issue crisis, you have to look multilaterally across many issues. But yeah, many of the examples and dynamics that Richard discussed are things you've experienced. So from your perspective in public health, where do you see the matter?
Well, it's similar and different. We're sitting in a country in the southern part of Europe with the oldest population in Europe, and this has an impact. If you think of the impact of diseases like West Nile virus. At the same time, we have been experiencing West Nile virus now for over 20 years. The first introductions were at the end of the 90s in the animal world, and then in the beginning of the 2000s, we had the first human cases. And now the challenge is moving forward. We've had local outbreaks of chikungunya and dengue in Italy, in different parts of the country, that were transmitted through the Aedes albopictus mosquitoes, so the tiger mosquitoes. And I still think we're neglecting a lot of the sandflies transmitted, and not only leishmania, but also arboviruses like Toscana virus, which can give severe health outcomes like encephalitis. And we really don't know much about them. Even the living in cycle of the sandflies in many ways is still not well studied. So I think we have a lot of challenges on our way. We are learning a lot, and definitely there's been, and I think I'd like to pick up on the world, a lot of momentum now, bringing health at the center of this narrative, and I think it's a great opportunities for what has been mentioning today, like the COP and other organizations. Another thing that I'd like to mention, which I find quite exciting, is the World Health Assembly decision to link space and global health, because this is opening the use of Earth observation data and health. And this is something, at least from a member state perspective, relatively new for us. And what I'd like to pick up is, how do we make this something operational? Because from my perspective, I'm a translational research person. So I try to really bring this into something that we can use in how we communicate to people. How do we change our preparedness and response plans? And this means sometimes finding alerts that can be very short term. So if there are, for example, environmental indicators that are telling me that the transmission is likely to increase, whether it's 1 year to the next, or from the beginning of a season, telling me this is going to likely be a bad season, I could actually act upon it and make a difference in the way we communicate to people and use it, trying to reduce exposure. And again, I think that we need to come back also to the community engagement, the social sciences, and all the things that have been said today, and try to make that impactful in the way we communicate and we are transparent about the data we have and how we can actually apply it for public health.
Thank you. Last question here for you, Spiros, it's a very broad one, but of course when we're talking about vector-borne disease, we cannot neglect the vectors themselves. And that's a whole other branch of research that has not really been discussed at great length yet today. But you've been at the forefront of this. Maybe you can explain some of the challenges and opportunities that you've been seeing in the area of vector control.
Okay, there are two periods, before 2010 and after 2010. So in the beginning, we were a small company specialized in mosquito control, and our target was Aedes caspio, a nuisance tide species, right? And then 2010, it came West Nile virus. And at that summer, we had 35 dead people, deaths, in the plain of Thessaloniki, in northern Greece. And then that's where we met Hervé Zeller, who came from the ECDC, and that's when I understood that these kind of institutions are very, helpful, because they came, it was Wim van Bortel, who is somewhere here, I suppose, and another woman, I don't remember her name, and they were very, with their authority, they just said to our ministry, let the guys do their work, because they are in the field and they know how to do it. So we just started with a lot of self-confidence, let's say. Huh? And from that period and on, we started to collect systematically data. So we put a lot of traps on stable positions, and now we have reached the point that we are gathering something like 300 field inspections, and we're producing something like 15 million records per year, and all these are geospatial, geo-referenced, and digitally, of course. And this is our, let's say, strong point. 2018, I read about it was a technical description about an award from the EAC with the title Early Warning for Epidemics. And when I read the technical description, I said, wow, this is what we're trying to do. I said trying to do, right? And we're still trying to do. The fact that we got in 2022 this award, that does not mean that we are very satisfied with the products that we have made. But what we're doing is just this, translational epidemiology. We're producing data, we're trying to share our data, and here I come as always, also as the ex-former president of the European Mosquito Control Association, which regroups many countries. We can talk later, perhaps, about our role in this kind of endeavor. But the important thing is now we have very nice collaboration with WHO as EMCA to make best practices with TDR. And that's where I finish, because I can continue.
Now is my cue to remind everybody that you have a Slido QR code. And if you'd like to ask questions to the panel, that's probably the easiest way to do so. I'll first take my own prerogative here as the moderator to ask a couple of questions. This came up, I think, quite a bit. You were discussing in the first plenary sessions the siloization of funding, and you're all working in different disciplines, and we're talking about a huge amount of different data sets. You talked about millions of data sets of geospatially linked cases and mosquitoes, and you're doing modeling with environmental data sets. We're talking about humanitarian crises and that sort of information, and Flavia, you have to deal with all sorts of surveillance data in your day job, I'm aware. From your perspectives, a little bit hands-on, doing research in the field, doing applied public health work or vector control work in the field, how do you think this could be improved? What data sets are missing from your perspectives, and how could this be strengthened? I'll start with you, Flavia, since you're closest to me.
Yeah, so I think silos was probably one of the words that was most said this morning, and I think it's something we have to be careful about, especially now that there is the momentum, there's going to be funding, there's going to be interest. We should not maintain or even create new silos, and I think this is a bit of a hazard that we're facing right now. I admit that I really liked the way that the colleague from the Pasteur Network described the idea of being not only multidisciplinary but also multi-level and multi-scope, and having the different things that we have to look at in different ways. And I'm not sure that we're missing data sets. My perception from my small point as a member state is that I might not even be aware of all the data sets that are there, and that we might need to link them better and use them be in ways that they haven't been used yet, and try to see how we can translate that into something that can become policy and an actionable policy that can be looked in terms of its impact and its added value at different levels. So I think we really need to keep that openness in being curious about each other and understanding what each of us is doing with our different priorities, of course, with our different ways of looking at what is impacting most the populations that we're responsible for, that we're looking at. But really trying to create those bridges that can help us work more so that we can do more with what is already there.
Maybe you want to elaborate on that, Joacim?
Oh, sorry.
Yeah, I was thinking about it. I think there's a lot of data in some of the fields and areas. So in climatology, in remote sensing, there is an abundance of data, I would say, at least if you compare to mosquito surveillance and human health data. So it's definitely, like, we absolutely need more and better data on diseases and surveillance programs, I think, and also on entomology. If we want to really follow and understand what's actually going on and what's happening, we need to have a better structure, a systematic surveillance in those domains. So there is ways to fix that, and to some extent it's also a scale issue, right? So it could be very expensive, and there is way to leverage citizen science activities, as we do in ID Alert project. We do citizen science with the mosquito alert. We do citizen science with tick image recognition and AI, and we also test out bioacoustic smart classification of vector-borne zoonotic diseases. So that's really a new dimension, but it's not systematic, and it's not something that really necessarily sustains after a project. So I think that's really key to think about. Another, coming back to the medical and health data, I think the integration of data across the sort of disease silos is also very important, because climate change is not affecting one disease at a time. It affects a range of diseases, and they have dependencies. They have dependencies in vulnerabilities. They have dependencies in cascades, and that's also super important. We don't always do these connections, which is also makes it necessary to actually integrate data on that level too.
Let me build on this question for you, Richard. I mean, there's also the flip side to the coin, which is the measures that we're adapting, right? And it was discussed how there's not a lot of research on evaluating the effectiveness of the impacts that are put into place. There's not a lot of knowledge in general on the impact. So the modeling that you're talking about, projection modeling, has been at the forefront, has existed for decades, but the rest of the field is really lagging behind. But meanwhile, there are measures put in place to adapt to climate change in other sectors. And I'm wondering how we understand what's implemented in one sector and what that might mean for infectious disease control in our sector. And you have some thoughts on it, I think.
I think it's a really good question. Learning from the South, because we're dealing with something that's come from the South in the North. Dealing with something that is taking apart populations in a way that we would not have predicted in urban settings in the South, but will take apart populations in the North in urban settings even more so. The immunology of populations is really important, and we know that people who live in cities generally have lower rates of vector-borne disease. So where we're seeing vector-borne diseases now scaling up in urban settings in Africa, as a good example, where they are new with invasive vectors, we can expect the impacts to be far greater in Europe, where nobody's had experience of the diseases before. But we shouldn't forget also that there's an awful lot of asymptomatic disease, and as diseases like flavivirus, particularly dengue, come into a country and you're reliant upon it having more than one serotype coming in, before you start to see people drop down and bleed like an Ebola case, and maybe then we'll really get serious, you need to have a little bit of time, and you need to be able to spot it. At the moment, we have a gulf of data when it comes to actual, really solid, easy-to-get epidemiology, because we haven't made the advances in viral rapid diagnostic testing that we made in malaria. That changed malaria control, having rapid diagnostic testing that worked. It allowed us to see where disease was, who had it. Even those that were asymptomatic, you could start to see better in, but you can now start to use diagnosis as a control measure for where you put your resources. We don't have that in Europe. We don't have it in developing world, where the diseases are far more abundant. So we can't really spot it. We see what happens at hospital level with serum analysis, but we don't see what happens which is hidden from us, which is asymptomatic disease, probably at a vastly greater scale than the current data indicates. And I think that's the thing, is we're only seeing the tip of the iceberg, those cases that come into the health system, not those that may be infected, and really the body of disease escalating and ramping up. So diagnosis is a massive area for research as a priority if we want to improve our ability not just to see it, but also to then put in place effective control. And the urban settings, there are really straightforward answers. There are really straightforward solutions with small amounts of good targeted research money for tools that can stop insects laying eggs in containerized water or in wastewater, or control them when they do. And those are all areas we've rather left redundant because of malaria and our great focus on that, rightly so perhaps, but at the detriment of others over the last few decades. So we need to turn attention in our research really targeted in that.
Spiros, what would you say about the gaps in effective control?
I totally agree with Richard. There is a lot of work being done in Europe lately. This system, this AVA system I was talking about, this is exactly where we are now. I will give you 2 or 3 numbers just for you to understand. We have 220 villages all over in 40% of Greece where we have small, hen pools. I mean, where we get, we bleed, young chicken. And this kind of information, we do three times per year. We don't publish. That's a problem, and we have to publish. But we're sharing our data. And so we do this, and what we do this as we use this as input parameter for our risk model for West Nile virus. In this model, we have another parameter is our larvae abundances that we find. And also the infected mosquitoes, because again, we have something, 180 trap sites, stable, I mean, for the last 5-6 years. So these are, data series, long data series where we provide, valuable data. So it is evident that we're not public, I mean, and that's a problem, but at the same time, it's good because we can go fast, we can use all the technologies we want, and lately we're cheap also. So rapid, cheap, and effective, that's good. So what we have to do is just to upload all this kind of data. We have started to do this, but only for the adults, for the individuals, for the, and we're doing it in a specific platform that is functioned by National Observatory of Athens. So everybody has access there. So this is the one very nice initiative that we have within the EMCA, the European Mosquito Control Association, which is to make an infrastructure for real data sharing, but with rules, with specific roles, with specific goals, right? Because otherwise we're messed up. So this is what we've been doing, and I think that's something that will make a difference. And the second thing is best practices. With WHO TDR, with Florence Fuk, actually, with Sandra Gever, my Director of Research and Development in Ecodevelopment, which is the president, current president of EMCA. We're doing this. And there, of course, we have other type of problems because as the previous session was indicating, the Cinderella syndrome, 90% is modeling, and we don't have a lot of data on evaluation. So we ended up with only 30 papers that we will focus on and try to get out the best that we can.
Thank you for highlighting that. I think that's, as we mentioned, a really important aspect is being able to exchange the best practice and just really understanding the implementation of the multitude of ways that we need to address the issue. I believe we should have some questions from the audience. I think the moderators were going to ask them, or do you want me to ask them? I don't have any questions. I guess I need to use the Slido code myself as well. See if this works. You have them. Okay, this is a great question that I'm seeing now from here. How can we ensure the data is translated into tangible policy recommendations or in general actionable results? So this is really building upon what we've just been discussing. Anybody like to start off?
I can just tell you a story of what we did in Italy. So, as I mentioned, waste now has been a problem for quite a long time. And so in Italy, we have this system by which we look at human data, we look at avian data, especially also wild birds, but also we have an entomological surveillance system that is not only a surveillance system as to what mosquito is there, but also monitors whether there's the virus or not in the mosquito. And one thing that we have decided to do is that we act upon the SOHOs, so the substances of human origin, and through deferral or suspension. And we don't wait for the first human case. We do it regardless. So if it's in a horse, if it's in a bird, if it's in a mosquito, it doesn't matter. We retrieve that donor and we say, no, we have to defer your donation. So we have avoided, in a way, people donating in areas where there has been circulation that could have transmitted their virus unknowingly because they were asymptomatic while they were donating. Now, the next step is, where do we go from here? So can we get information on environmental variables that is going to give us an earlier warning as to, maybe this is likely going to be like now, between now and March, next year's season is likely going to be worse, so maybe we should have a different kind of preparedness plan that enhances, for example, a number of things, so vector control, prevention through information communication in ways that you wouldn't be doing in a regular season. Is there something we can do on the short term? Are there some things that we can do from 1 week to another? During heat waves, what can we expect? In some areas, there might be an increased likelihood of transmission. In some areas, there'll probably be less, because if it's too hot, then transmission doesn't really work well either. So I think this is the kind of thing that I would be very interested in learning from the scientific community, because then maybe we can bring that into the way we react, we prepare, and we respond to a disease.
Thank you. I think you're okay with two anxious, Spiros and then Joacim.
Yeah, just short. I think it's really important to use participatory approaches in that process as well, because it's really a co-working process with users, policymakers in local places. Like we in IDAlert, we engaged with the public health agency in Barcelona. They were about to change the storm drains to because they suspected it would actually create breeding sites. So in this evaluation process, we designed a randomization of that change so we could actually evaluate it. And that would give much better value for them because they actually know what impact it has, and it would also give value for others. I think that's one example of value. Another example is how the EU project and EEA, we had it before, set up this observatory where we could, in the end of the project, when you do a project, you do research, you end up producing indicators, but like after the project ends, there's nowhere to put your data and your models or whatever you developed. And that's an excellent opportunity, really, to be able to upload data into the observatory and it comes closer to policy. It doesn't necessarily translate directly to policy, but it's accessible in another way.
Okay, so the AVA setup was exactly this. The idea was that we provide predictions for abundance of adults and for the epidemiological risk for West Nile virus. The receivers of these, let's say, outcomes of these models were 8 regions, 4 in Greece, Veneto in Italy, 1 German, 1 French, and 1 Serbian, Novi Sad actually, in Serbia. So from the beginning, as I said, we're not really enthusiastic about the outcomes of these, but that's the way. I mean, that's the way. And us, as Ecodevelopment, we are also working on prediction model for the larvae. I mean, because we have tens of thousands of geo-referenced breeding sites, potential breeding sites. And then we have to go once a month, once a week. How many times? Can you imagine? I have something like 120 guys with tablets circulating all over 40% of Greece, trying to figure out where to go in order to, and the success rate is 20%, 15, 20%. So we must increase this kind of success. So you can imagine and the other thing is then once we get indications about the pathogen circulation, independently of the modeling, because we're not, the models are now just a tool for decision support system, right? We're using indices so that we can go and intensify larviciding or even sometimes adulticiding, when in view of the imminent risk.
Go ahead, Richard, if you have something.
Can we do the second question?
Yeah, we have a lot of good questions. So this one is from Nadia in the audience, I believe, from the Zoe EU project, about land cover changes in biodiversity and understanding that, which is, of course, a major determinant of the ecological niche for different vector-borne diseases. So indeed, it is, I think you've answered your own question. It is important, I'm sure they're going to say, but let's hear why and how it can be done.
So we often think about insects being out there in the woods or in the streams or in those nice open surface pools. Land mass change, land usage change, is probably the greatest threat that is posed to European living in the Mediterranean for sure, but now way beyond that too, over the next decade. And that's because we're bringing wildlife into cities. And it's where policy for mental health may clash quite badly with real health risks that are physical health. We have a policy for greening cities in Europe. It's an absolute disaster because it threatens human health greater than any single action that man's done in the last, I don't know, decades, if it's done in isolation. If urban planners and garden creators and planters of building greenery, and we have very good examples of this in Holland and in China, and in China it's gone ghastly wrong, where in order to have green in a city for a really nice place to live and a much better mental health area, you have to bring water in. And water is, in all circumstances so far, the principal agent in which these invasive vectors that transmit dengue, that will transmit malaria in cities, even in the Mediterranean, that transmit other flaviviruses, use to lay their eggs. And they will use the smallest top of a bottle if it's got water in. And of course, what we're doing in climate change mitigation is encouraging people to collect water from their rain and have rain buckets. We're creating entire rainwater recapture systems in cities and channeling water in ways that we've never done before, but we're doing it without consideration for what that does in terms of creating vector breeding sites. In China, they have made a city that they greened, and it became uninhabitable before the properties even took up residence, even though they sold them all. And that's because the vector population is much smarter than we are. It gets ahead, it sees every opportunity, and it monopolizes places to live in. So when we talk about de-siloing, we're talking about urban planners needing to work with entomologists, gardeners and municipal services needing to work with health, and with veterinary science as well, because as we've seen with West Nile and others, animals are involved in the life cycles. And there is something inherently difficult about that, because we have been born into a system of individualism. My name is on the paper. And I didn't give the data to you before I published it because it's my credit when I get my paper. We have to be able to tackle the reality that not only is man's folly its glory, but it's probably the greatest challenge we have is to just de-silo our thinking of terms of who gets the glory. Well, let's start doing something together that is incentivized in some way that allows us to work together across all of those sectors and start tackling cities, greening policy. Maybe adjust the greening policy so that it has to have that level of cooperation in a practical way to start.
Joacim and Spiros, you have some quick comments, so we get to the next question after.
Yeah, I think it's a really important comment. There is so much nature-based solutions in all over the world, and it's going to be more, what I see, and they're really important. I mean, it's one of the biggest challenges with biodiversity. It's a huge challenge with climate change as well. To some extent, they could serve win-win solutions. So you could have flood protection from nature-based solutions, and you could have mitigation because you have biodiversity and sequestration and so on. To some extent, you end up in these situations where you have unintended consequences, I think was the EU lingo for it. And those need to be planned ahead. So what actually happens in this sense is there's a policy and an action which drives a change in a sector, and then there's an unintended consequences on another disease. What I see in the projects that we're working, we're in this cluster for climate change and health. We work particularly on infectious diseases and vector-borne diseases in our project, and then there's other projects working on heat and so on. But designing these solutions, which I think the urban parks, for example, which are heat-related and air pollution mitigation and biodiversity, we should sit together in one project, actually. There should be this intersectoral participation of experts from different topics integrated in these solutions with architectures, with urban planners. And that's not really happening. So I think that's really quite important to address.
Exactly. There is an official platform from the European Environment Agency, which is Climate Adapt. And they are referring to 58 policy adaptation options, right? And in only one, they're talking about the mosquito. And I knew about it because it was the AVA, the system that I told you. And then I figured out how come it cannot be possible, because if you just read the description of these kind, it's greening, it's flood, it's 36 out of the 58 envisaged adaptation policies that would have implications in the vector-borne diseases. And I don't know, the ECDC should perhaps tell them.
Thanks. We have another question that had a lot of likes, and I think it's a really important one. This is, of course, a session on vector-borne disease, but as an aside, the indirect impacts of climate change, I think, on many infectious diseases is a highly understudied area. My colleagues in our sexual and reproductive disease and health group recently shared a great paper with me about the many indirect ways that climate change is impacting program delivery and thereby impacting sexual and reproductive health. So I think there is a huge resonance with this question. The question to the panel then is, women are disproportionately impacted by climate change and infectious disease. Data collection, research and innovation is usually sex and gender blind. How do we change and address this? Would you like
I think
to?
it's the chance for the women. For women, yes. I mean, if you try to hire people to spray, I mean, women are not. But if you're talking about, artificial intelligence or GIS or things like that, I mean, high technology things, yes, women are, and of course, women also, I don't know how you're feeling. They collaborate very well. I mean, and of course, and also they can, be very collaborative and be very creative as well. I mean, so that's very good for everybody. I mean, they should get into the mosquito control, into the surveillance, into everybody. I mean.
I could just step in. There's a lot of things we don't know yet that are gender related, even to the way we react to infections. One of the projects that we're working on now is really trying to see, looking at clinical evolution, immunological markers, and severity markers of disease, and how this is related to sex, is related to age, is related to a number of things. So I think we need to, at least from my perspective, I'm a medical epi, so I'll bring this more clinical perspective, I guess. But there is definitely work to be done in order to be able to address diseases related to climate change in a more gender-oriented perspective, but also a perspective that can take into account the different age groups and different populations that we have, not only in terms of vulnerability, but also in terms of their biology and the way they react to disease. That's one element.
I think what you mean, I mean, the vulnerability dimension, better understanding vulnerabilities and the dynamics of transmission and impacts, of course, is really quite essential. From your public health perspective, I mean, you deal also with a lot of case-based data, and that's not gender blind at least, but maybe it's patchy and maybe the range of risk factors that it covers. I think this was alluded to in the plenary session as well, sometimes not comprehensive enough to do really detailed analyses as well, or is that the case?
Well, some basic variables like perceived sex or self-attributed sex and age are normally there. So for some diseases, we already know that there is a greater risk in certain groups. I was mentioning earlier for West Nile virus, because we know that the more severe disease is usually more frequent in the older age groups. For some diseases, for example, when we had our chikungunya outbreaks, actually, or for our Toscana virus, it's the males that tend to be bitten more in some more, sometimes, well, first more urban and the other was more rural settings. It depends a lot on the type of disease and the type of exposure. It has to do with the social role that you cover in the country. It may be different in my country compared to another. So definitely there is more work to be done. I think there is greater awareness, I think, now of the need for this. It's not just your classical first stratification you do. You have to look behind it and see what it means in terms of the social environment and in terms of the living context. And one thing I was catching a lot from speakers today, I think we really need to move beyond our own way of looking at a problem, whether it's a disease or not, and thinking of it more as an ecosystem where different aspects contribute and where the person who might be experiencing that disease has its own story and his own reaction to it, which might be quite different if it had been somebody else. So I think in that sense, that's an opening to work more together. And as I was saying before, being curious about each other and trying to move, I really agree with that, trying to move beyond our natural ambitions of being recognized for our work through publications and trying to look into this multi-layered collaborations that we need to find.
I don't want to complain, Flavia, but you just stole all of my summary notes here on this document, so I'm just going to throw that out and go on to, no, it's great. Great answer. We have covered a lot of ground, as you just referred to. So with the last minute or so for each of you, what would be an area, if you could wave your magic funding wand and identify something that would really impact vector-borne disease control and climate change and health going forward in a meaningful way, what would you choose to be funded? Who would like to go first?
Yeah, I think in a sense we've been touching on it in the earlier session, the action component, interventions, evaluation, really important. What can we actually do? And how can we guide action? How can we provide evidence that's safe without these unintended consequences? And where you have win-win situations, win-win solutions, so you do address both mitigation and adaptation in the same. I think that's really convincing. If you have this type of solutions, you could easily push action, and that's really, really important.
Go on.
I'm the son of a builder, so I'm very practical. Two things that would dramatically change the risk of disease to us in urban settings and in rural settings. One, rapid diagnostic tools, as good as the malaria rapid diagnostic tools that we have and have had now for 20 years. That would dramatically change how we see disease and how we target it. How do we target it? Well, urban settings are going to be our greatest area of need in the next year. We sprayed Paris last year, 2 suburbs of it. We sprayed most cities. It's not an approach that will work. You need to understand the biology of disease and target new tool development to intervene either where the insect lays its eggs or to intervene where that insect would hunt a person and bite them to feed on their blood. And that's not a net, it's not spraying, it's not just taking conventional malaria tools and readapting them. It's making tools fit the life cycle and the biological behavior of the vector in an urban setting where we didn't have it before. That means fresh eyes, fresh thought process, but 2 lines of tool.
Yes, I totally agree with you, Richard, this time. Yes, the urban environment has another problem. We have a problem in the access to the courtyards, to the people's, property, and this is a legislation problem that has to be resolved because otherwise we will not. We have in the villages, we are visiting 40,000 houses in northern Greece every year, with a percentage of 70% of success, which is okay, fine, but it's not fine, The second thing is, I think, data sharing and collection structures should be really, reinforced, mandatory, paid for, I mean, they should be from your side, and the third thing is, who are the players? Because in Italy you have another system, in Greece we have another way of doing things. The regions, the directorate, the General Directorate of Public Health are the main actors. And the ECDC should talk to them directly, not indirectly through the ministries. You can choose, I'd say, 30, 40 regions that have a huge problem now. We know who they are, right? And talk to them directly. Don't use data brokers or, what other intermediaries, And of course, the big challenges is the ECDCs, the national CDCs, right? The Greek CDC, the Italian CDC. These are the alliances, the physical, but yet bring into the game the regions.
Great. And you briefly, Flavia, last.
Yeah, I think it's sometimes it's even the municipal level, because vector control is done at municipal level and some of the authority might be there. Just to add a little bit, another element, maybe insecticide resistance would be something we need to look into, at least for some mosquitoes. It's becoming a bit of a problem in some areas, and if the spraying is going to go on, it's likely to increase. So that's also because of the suboptimal, unfortunate spraying that sometimes we do. But we have to find again ways to work across all the different levels and decide how to do that and how do we measure impact of vector control. And that's definitely been it's nothing new. We know that there are difficulties in looking into that. But I think at the end, I totally agree with everything that was said. And I said, as an implementer, we look for solidity as well in the data. So something that we can, use in a plan means that is something that we're pretty sure that's how it is. And so I think there's also a need to collect all the research that has been done. Let's look into, what are the recurring things? What can we say we have really understood about vector-borne diseases and climate change? And then we really push into putting that into the policy at the different levels. Because I think there's probably quite a lot out there and we can start bringing things together.
Thank you. And with that, we're coming to a close. I'd like to thank all of the speakers for their insights. For those of you that put questions that didn't get answered, I apologize for that, but do find them at the breaks and ask them directly. And meanwhile, I'd like to give a round of applause to the four great participants in this panel.
In the meantime, to everybody in the room, please remain seated. We're going to wait a couple more minutes, like 3-4 minutes, until the other people come back from their parallel sessions, and then we'll continue with the plenary program. So just a moment longer.